In 2016, we launched 2 different rounds of opportunity grants to support new ways of improving health and healthcare in Central Texas. 80% of health occurs outside of the clinics and the doctor's offices. So we really launched this to introduce new ideas and innovative ways to transform health that we hadn't had a chance to do before.
The state of Texas ranks 50th in the country for providing services to individuals with intellectual and developmental disabilities. There is over a 15-year wait list, and there's over 500,000 people currently waiting for services today. The Arc of the Capital area is one of the oldest continuously operating nonprofits in Austin, celebrating over 70 years. We provide services in education, employment, independent living, educational advocacy and transition, and dog therapy. We were excited to find out that we were awarded funding from St. David's to pilot and develop a health promotion program for individuals with intellectual and developmental disabilities.
In order to build programming that addresses the highest priority health needs for individuals with intellectual and developmental disabilities in our community, we conducted needs assessments.
Obesity is one condition that affects all of us, but we're seeing disparities, whereas for the general population or non-IDD community, about 1/3 of us are obese, and what we see with the IDD community is around 55%. Physical activity is one of those key behaviors that can help prevent obesity.
Exhale, roll forward into cat pose.
Unfortunately, with the IDD community, we see about 10 to 13% of the population are currently meeting physical activity guidelines. Dental health actually is another key issue. People with intellectual disabilities have been found to have more untreated caries, as well as higher prevalence of gingivitis and other periodontal disease. Access to health care service is another real challenge for the IDD community. We find that just under half of adults with IDD experience delays with receiving primary and periodic preventive care. And there's a lot of reasons, a lot of barriers for why. Some of these include just difficulty using services, difficulty getting referrals, as well as the obvious, inadequate insurance coverage.
We even discovered an unintended, unaddressed area of need around mental health.
Mental health, of course, is a key issue that affects all of us, and so really important service the ARC is providing is that place for community. One thing that we're seeing in our field, a growing recognition of the importance of community and environments on shaping our behaviors. Care staff actually can provide direct support and modeling for behaviors that include physical activity, as well as being change agents for bringing in more programming to really create an environment that makes the healthy choice the easy choice, and doing that in partnership with ARC clients.
I want you to pull your toes back towards you, okay? And this activates all the muscles in your legs.
We use evidence-based models to design and deliver person-centered health promotion activities, transforming health outcomes for the Central Texans with IDD.
I learned about brushing your teeth, hygiene, and exercising.
Our program works in collaboration with the Central Texas Food Bank, providing cooking classes. We also work with the UT School of Nursing, where the students deliver health nutrition classes for our students. We also work with the UT School of Public Health, creating activities and program evaluation.
I like that it's very active, and we get to get out in the community and take walks.
We work with Sunshine Gardens, where we maintain a plot where our students learn to grow food.
We plant okra, we plant tomatoes, we plant broccoli, cauliflower, spinach.
And we also work with It's Time Texas and Stronger Austin, where they help us keep a finger on the pulse of what's happening in the community with health and wellness.
My favorite part is exercise.
We increased awareness of health promotion opportunities and access to health care for more than 65 people with IDD across 5 counties.
We're in the process of developing a health and wellness online portal for individuals with intellectual and developmental disabilities and their families. We have created toolkits that we are able to disseminate to people interested in creating or replicating a similar type program. We've added additional classes in our education program, and we're looking forward to continuing to grow our partnerships.
Just under 1 in 5 people in the U.S. actually have an intellectual or developmental disability. So they are our brothers, they're our neighbors, they're our friends. We as a Central Texas community have always come together for each other, and this is an opportunity for us to do more.
I feel good about myself.
As the CEO for the Arc of the Capital area, we are so excited about our partnership with St. David's and the UT School of Public Health. We're excited about the future and where this could go.